Hey again everyone, and welcome to another lecture from CyberMD. In this lecture, we will be discussing the can't-miss diagnosis of atrial fibrillation as it applies to the USMLE STEP 1 exam, as well as clinical practice. Let's get started. Atrial fibrillation is a type of heart arrhythmia which is an abnormal heartbeat. It occurs when the electrical signals that control the heartbeat are disrupted. This leads to the heart's two upper chambers, the atria, quivering instead of beating effectively. This results in an irregular heartbeat, which can be rapid or slow. One of the most recognizable features of atrial fibrillation is its appearance on an EKG. On EKG, atrial fibrillation will display an irregular rate and rhythm, meaning that the time between the beats is constantly changing. Additionally, there will be no clear, discernible P waves present. These waves, which are usually seen on an EKG, indicate the contraction of the atria. However, since the atria are simply quivering or fibrillating, there is no strong or organized depolarization to form a P wave. Additionally, you can actually feel atrial fibrillation before you see it on EKG. Simply palpating the patient's pulse will tell you whether or not they are in AFib. If their pulse is irregular, then they are in AFib, and you will confirm the diagnosis using an EKG. Patients with atrial fibrillation may have several signs or symptoms. These may include palpitations, which is the feeling of a fast or irregular heartbeat, which can be noticeable as a fluttering or racing sensation in the chest. Patients with AFib may also experience weakness or fatigue. The heart's inability to pump blood effectively can lead to these feelings. Shortness of breath is another symptom that these patients may experience. The heart's inefficiency can cause a lack of oxygen to the body, leading to the shortness of breath. There is the possibility of chest pain. Although rare, some people with AFib may also experience that symptom. Some patients facing this pathology may complain of dizziness or fainting. The irregular heartbeat can cause a drop in blood pressure and circulation, leading to the dizziness and fainting. Additionally, there are several risk factors for developing atrial fibrillation. These include age, family history, high blood pressure, heart disease, obesity, sleep apnea, and excessive alcohol consumption. People with atrial fibrillation also have an increased risk of developing thromboembolic events, such as a stroke. This is because the quivering of the atria can cause blood to pool and form clots, which can then travel to the brain after being ejected from the ventricles, and then they will cause a stroke. For this reason, anticoagulation should be considered for patients with atrial fibrillation based on their risk of stroke. This can include medications such as warfarin or dabigatran, which can help to prevent blood clots from forming. Typically, the DOACs, or direct oral anticoagulants, are preferred. These again include dabigatran, rivaroxaban, and apixaban, amongst others. In order to treat atrial fibrillation, several different approaches can be taken. These can include medications such as beta blockers and calcium channel blockers to control the heart's rate and rhythm, electrical cardioversion to restore normal heart rhythm, and even surgical procedures such as an ablation, which involves destroying small areas of heart tissue that may be responsible for the ectopic depolarization and the subsequent arrhythmia. In conclusion, atrial fibrillation is a type of heart arrhythmia that is characterized by an irregular rate and rhythm on EKG and a lack of clear P waves. Risk factors include age, high blood pressure, heart disease, and excessive alcohol consumption. People with AFib have an increased risk of developing thromboembolic events such as strokes, and anticoagulation should be considered for these patients based on their risk profile. Thank you for tuning in, and please be sure to like, comment, and subscribe to our content so that we can continue to provide free medical education resources to students around the world.